Okay, this is the FieldRN Orientation for Home Care Network. In front of you, you should have a packet with the information that we are reviewing also on screen. The following information is relevant to the success of the role of the FieldRN here at Home Care Network. Please read over carefully and learn all the information that's being given to you. If you have any questions, please contact your Director of Nursing. If that information has not been given to you already by Human Resources, make sure that you do ask either Human Resources or contact your particular office you've been hired for and find out the name of your Director of Nursing and her contact information. Now we're going to go over the office structure. The Director of Nursing is responsible for the day-to-day operations of your office. Each office has an office manager. The Director of Nursing manages and supervises all clinical staff. This includes office and field staff. The office manager manages and supervises all clerical staff. Each office is set up according to the needs of the individual office. You will be instructed on the layout of your office staff by a designated person. It is the responsibility of the FieldRN to learn each of these roles and have knowledge of the significance of each employee in the day-to-day operations of the office. Now let's go over the chain of command. It is very important to follow the chain of command to ensure the success of Home Care Network. Each agency has an assigned administrator that is responsible for each office within that agency. The executive administrator is the immediate supervisor of the agency administrators and is executive manager for the clinical, training, education, and billing departments. The executive administrator oversees all agencies and is first in command on clinical decisions for Home Care Network. At any time that you have concerns, questions, and/or issues, you must contact your Director of Nursing. If the Director of Nursing is unable to assist you, it will be reported to the administrator. Allow the administrator time to address your concerns. The administrator will address your concerns and questions, and if the administrator does not have an immediate answer, your questions and concerns will be directed to the executive administrator. Home Care Network asks all our staff to be open to change at all times as we continue to make decisions to progress towards the continued success of the company. Welcome to the team. We're happy you are here. Okay, let's go over the referral process. If a referral is called into the office by a physician's office, the office nurse, it can be an RN or an LVN, must document the following information: the patient's name, Medicare or insurance number or insurance information, the patient's address, phone number, physician's name and MPI number, the contact person for the patient, any special instructions and pertinent information, and other payer sources. Instruct the caller from the physician's office that someone from the intake department will contact them if further information is needed. The office nurse who receives that order will make sure to write an assess and admit order, fill out the intake information, and send to the intake department, and make sure to CC the intake director, your agency administrator, and your executive administrator. If the referral is called into the office by anyone else other than the physician's office, give them the intake department phone number, which is 877-270-2001, and direct them to contact the intake department with any other information. Referrals are generally received by the intake department. Now, once a referral is received by phone or fax through the intake department, the intake director will make decisions whether or not to accept or decline that particular referral. If it is accepted, the intake staff performs the following. They complete the intake information on Kenzer. They check the payer eligibility, and benefits. They complete an MD order if on the intake side, if they did not receive an order from the physician, they may contact the office staff or the nurse in the office to obtain an order. They call the patient to verify the information, and then they allow and inform the patient, letting them know that a nurse will contact them to set up an appointment for admission. They then go ahead and enter all the information into Kenzer. They then send a heads up email to the office. The office will then forward that email to the admitting nurse. On that email, you will receive the patient's demographic information, any specific orders or instructions from the physician's office, and the disciplines that have been ordered. Even though you receive that heads up email with that information, make sure that you do go to the patient's chart on every single admission and review that patient's H&P to ensure that nothing has been missed. Sometimes an order to draw labs on admission or a particular order to give an injection may have been missed by someone along the way, so you want to make sure that as the admitting registered nurse that you go in and review all orders and H&P that have been sent. That information is attached to the patient's chart under miscellaneous, and you'll see H&P, and you can click on that icon. Once you've admitted the patient, you want to make sure that you go back to that same heads up email, reply all to everyone that's on the report, and give report on that particular admission. The template will be sent to you when you receive the email for you to fill out. You go in, you report the frequency of all the different disciplines that you want to go into the home. You make sure to give report on what's going on with the patient, any problems with patient, family dynamics, or caregiver, and any particular instructions that anyone on the office side needs to know on that patient. Now let's go over discharges. All discharges must be reported and approved by the DON before any discharge can be performed. The Director of Nursing will discuss discharge with all the staff that were involved in that patient's care and will make an informed decision on whether discharging that patient is appropriate. The Director of Nursing is to ensure that all services and needs of the patient has been met. If patient on service for teaching and training, ensure all teaching goals have been met. During morning meetings in the office, discharges are discussed and ensure that patient have been given 5-day notice and the RN has been assigned to perform that discharge visit. Avoid discharging from the desk if at all possible. We want to make sure that we are performing a discharge visit. The clerical staff. The immediate supervisor of the clerical staff is the office manager. The clerical staff includes the office assistant, clinical assistant, anyone in medical records, and also the scheduler. Anytime there is a problem with any of the clerical staff, this problem should be brought to the office manager. Let's review the tasks. Tasks are chosen by the registered nurse. They are in the form of a drop down when you are inside of your Oasis, and then also there's different tasks that can be chosen in your communication note, inside of your skilled nurses note, and also your physician order. You just click on the drop downs and you will see the templates that will allow you to be able to choose those different tasks, and templates that have been put in just allowing you to be able to not have to do a lot of typing. So anytime that you choose a task, please make sure that you do edit it and make sure that it is specific to that particular patient. All tasks should be relevant to the patient's care, and that includes disciplines, teaching, skills, etc. When you're on Kinzer and choosing tasks on your Oasis, we have gone in and entered specific tasks or interventions and goals that are relevant to disease processes or diagnosis. Make sure when you are setting up your plan of care that you are choosing those particular drop downs or templates in order to ensure that the plan of care is specific to the patient's needs. Now you can still choose the different interventions that are in the Kinzer software, but we would like for you to focus on the different tasks that are diagnosis or disease process specific. Every discipline in the home should be listed on the patient's plan of care. The teachings that are relevant to the current episode should be used. The RN should not choose a teaching for every single diagnosis because it would be impossible to do them all in one 60-day episode. There should be billable skills performed on every nursing visit. Clerical staff will not confirm the receipt of the visit without a billable skill. In this case, the visit will be rejected and returned back to you for correction. On your M2250, on your Oasis item, if you answer yes to any one of those particular tasks on M2250, you must make sure that that particular task that you checked yes on is addressed in the patient's plan of care. You will be able to use your drop down on Kenzer for your templates. So for your vital signs, your foot care, your fall prevention interventions, depression interventions, pain, pressure ulcer prevention, and also your wound care. Make sure that if you check yes on any of these particular items on your M2250, that they are addressed in your plan of care. And again, you can use your drop down to find those. Your Oasis. The Oasis is the Outcome and Assessment Information System. It is the tool that we use in home health to collect accurate and pertinent information regarding the patient, supportive assistance, and the patient's environment. This is used by all qualifying clinical staff, must be complete and accurate when turned into the office. Case managers and other designated RNs in the office review all Oasis before they are certified for approval to send to the state. It contains mapped out components called M item numbers. You will later on in your orientation go over your Oasis training webinar also. So you will then be able to receive detailed information on how to complete the Oasis. The Oasis not only is a clinical tool, but it also is used by the billing department in order to obtain reimbursement from either Medicare or any other payer source that the patient has. So it is very important to make sure that you do understand the Oasis and how to accurately complete the information. Your HHRG scores and equations. Like I said just previously, your Oasis information is collected in order to obtain reimbursement through Medicare and other insurance payer sources. The HHRG score is what is calculated according to your assessment, and it determines the Medicare reimbursement for a 60-day episode according to your assessment. It is the responsibility of the assessing clinician to perform a complete assessment and document accurately to the patient's needs. Each discipline and frequency must reflect the assessment. Your HHRG score is made up of C, F, and S. Your C are your clinical M questions, also includes your diagnosis. Your F related to your functional, which is your 1800 ADL, IADL questions. And the S is related to service, and that is only therapy. On your M2200, where your number of therapy visits is addressed on your Oasis, please make sure that you are using 12 for if only one therapy discipline will be in the home, and 14 if there will be more than one therapy discipline in the home. We do have to give an estimated number on the Oasis. So these are the two numbers that you need to keep in mind anytime that you're performing your Oasis and putting therapy in the home. On your ICD-9 coding, your first 6 diagnoses have the potential to contribute towards your HHRG score, which again is your C and your CFS for your calculation of your reimbursement. The RN that is performing the assessment should decide the primary reason for home health. There is an RN on the office side that will review your coding and make sure that your diagnosis and your coding information is correct, so that particular Oasis will not be rejected, and we make sure that we are following coding guidelines. As an RN in the field, you do not have to know coding guidelines. What we want you to do is to make sure that you are putting the primary reason that we are in the home as the primary diagnosis for home health services, and then list all other pertinent diagnoses related to that patient's care for home health services. We will make sure on our end to put them in the correct order or follow any particular coding guidelines and regulations that we need to follow. Diagnosis codes should provide an updated and accurate picture of the patient's health status. The RN lists each diagnosis related to receiving home care. M1024 is used when a V code is used. Again, you don't have to worry on your end as a field RN about V codes. We will take care of that on the office side. Now let's go over the episode equations. There are 4 equations that Medicare and other payer sources use in order for reimbursement for home health agencies. If your patient falls within equation 1, 2, 3, or 4, it depends on if they're in an early episode, a late episode, if they have low therapy utilization or high therapy utilization. So, for example, equation number 1 is a patient that is in an early episode, which is either their first or second episode of home health, with low therapy utilization, which is either 0 to 13 therapy visits. If you look at equation number 2, that's an early high. Equation number 3 is a late low. And on your late, that is the patient's third or any additional episodes after the third visit for all home health services, not just with our particular agency, but anytime a patient has not had a 60-day delay between home health services, their episodes continue on. And then you will look at equation number 4, and it's a late high. So if a patient gets admitted and by their third episode, that patient is still on services with us, their equation would change from equation number 1 to equation number 3. That patient may have not a whole lot of change in their progress during their home health services, but they may have some progress. Between equation number 1 and equation number 3, there is a difference in the reimbursement from Medicare and other payer sources. Please make sure that you do understand that all of your Oasis are due the following business day by 10 a.m. and there is a late penalty for Oasis visits, and there's also a daily late penalty for your skilled nurse visits. Also, whenever you perform your Oasis, please make sure that you are doing an Oasis check and your PPS analysis. The Oasis check is a part of the Kinzer system. It goes through and reviews all of your Oasis documentation, but then we've purchased the PPS analysis in addition to the Oasis check because the PPS analysis also goes through and reviews all of your documentation, but it will find things in detail. So even if you go through, you fill out all of your information, the PPS analysis will pick up things, for example, in your diagnosis. If you've coded a diabetic code and the manifestation for that particular diabetic code is not included, it will pick up that information, and the Oasis check does not. So you want to make sure before you submit your Oasis to the agency, always perform your Oasis check and your PPS analysis, and you will learn how to do this as you go through and you learn Kinzer. Okay, now let's review the 485. The 485 is the patient's plan of care. The 485 is not approved until after the Oasis has been approved because we do have to ensure accuracy in the Oasis and the 485 matching. So on your end, when you submit your Oasis, once it is approved, if a signature on the Oasis is needed, that will be in your hotbox. But then anytime that the 485 is then created, you will always see that in your hotbox and it will be waiting for your signature. To go over a little bit more on your paperwork being due, all notes and Oasis visits, all the paperwork is due to the office by 10 a.m. the following business day. A designated employee is assigned by the office manager in each morning meeting. They review this information, and if paperwork is not received in a timely manner, they will be contacting you. If an employee is reported to be uncooperative, then that information will be reported to the Director of Nursing to follow up with you. Please make sure that you're courteous to the clerical staff as they are contacting you, because this is part of their job to make sure that all paperwork is received in a timely manner. We do now have a new policy that you may have signed by now before you got to the point of watching the videos. The late penalties are different amounts for the Oasis versus the skilled nurses note. Please refer to your signed contract on late penalties. Okay, let's review schedules. The scheduler reviews all patient schedules every Monday. As a registered nurse, your schedules are a little bit more set up to be a little bit more flexible than other disciplines because we're receiving referrals on a daily basis. Patients are getting out of the hospital at different times, and we do have to make sure that we are freeing you of regular skilled nurse visits so that you can perform the Oasis visits that can only be performed by a registered nurse. But you want to make sure that you are reviewing your schedule every Thursday. And if there's any changes that need to be made to your schedule, please make sure that you're getting with the scheduler as soon as possible before that following week begins. We do want to make sure that we're staying on top of the accuracy of the schedules, especially if you're a full-time employee, you have certain visit quota that you have to meet each week. That is the responsibility of the scheduler to make sure that you are meeting your requirements and that they are getting the visits scheduled to you in a timely manner. If for any reasons the visits are not being scheduled to you in a timely manner and you have some concerns, please make sure that you are bringing those concerns to your Director of Nursing. Also, when you are reviewing your schedules, make sure that you are paying attention to the yellow sticky notes and also the purple sticky notes. On your yellow sticky notes, that will be information that the office needs you to know on that particular visit. Your purple sticky notes are for that patient's episode, and that's information that all disciplines need to know and review before a visit. That could be the caregiver wants you to call them. That could be there's a code to get into gate to the certain apartments. Make sure that you are always reviewing that purple sticky so you don't come across any problems that can be avoided up front. Also, be mindful that the scheduler is going to review your requests for changing your visits and moving them on to different days, but that scheduler is responsible for making sure that we are staying in compliance. So if a wound has been ordered by the physician for the wound care to be performed on Monday, Wednesday, Friday, and you're trying to change your Wednesday visit to Thursday, the scheduler will bring to your attention that that is not the order. Or if you're trying to move a supervisory visit for the home health aide outside of the 14 days, that will also be brought to your attention so that we make sure we are staying in compliance on our end as an agency. You want to make sure that you are paying particular attention to some of the different activities that we do make sure we are taking care of as an agency. That's your 14-day soup visits for your home health aides. Make sure that you're performing your LVN soup visits with your research. If the patient is receiving any injections, that should be set up as a task. Any lab work, for instance, PTINRs, those are set up by the visit, so you will be able to know that a PTINR or cath change is needed on your particular visit. Your 14-day wound evals, any particular wound care, if catheter care is needed, and also any patient or caregiver requests. One thing I do want to point out is make sure that your research are being performed within the last 5 days of the certification period. We do have quite a few RNs that do get upset because they end up performing the research 6 days out, and we have to get you back out there within that last 5 days to do it again. So make sure that you are performing your recertification visit in the last 5 days of the cert period. Okay, let's go over complaints. All complaints are reported to the Director of Nursing or a designated person upon the DON's absence as soon as possible. Each complaint must be documented by the person receiving the complaint on the patient complaint form. The complaint form must be filled out completely and accurately. All complaints must be investigated upon receipt without delay if at all possible. The Director of Nursing or a designated person must follow the protocol, which is to take action, follow up, and make sure that we are documenting. All complaints must be completely resolved within 30 days of receipt. Each complaint must be investigated without prejudice, so no matter how minute you may think a complaint is, it has to be investigated. So please make sure that any complaints that you received are reported to your Director of Nursing, no matter how minute you may feel the complaint is. Your Director of Nursing will report all complaints to the Administrator and Executive Administrator in a timely manner. All complaints are kept in the complaint notebook, which is kept in the DON's office. The Director of Nursing will make sure that to report all complaints involving abuse, neglect, and exploitation are reported to the Administrator immediately, because there are further steps that have to be taken. For employee concerns, as a home health agency, we are always advocates for our patients, but we are also advocates for our employees. So any concerns, issues, questions that you may have, please make sure that you are reporting those to the Director of Nursing or designated person upon the DON's absence. If you have a concern or an issue or a problem with another HCN employee, or if you see a problem or an issue in a patient's home, you want to make sure that you are reporting those things. So your employee concern is regarding patients and also other coworkers. And we will make sure that we get those resolved. If it involves abuse, neglect, and or exploitation of a patient, please make sure that that is reported to the administrator immediately. Now let's go over the Medicare qualifiers. All RNs in home health should have an understanding of what particular tasks or skills are performed in the patient's home qualify as a skill in order for Medicare to reimburse a home health agency. Observation and assessment is for a maximum of 3 weeks. So you have to make sure that anytime you're admitting or recertifying a patient or doing a resumption of care, and part of your care plan is observation and assessment, you have to make sure that you have additional skills or Medicare qualifiers that your nurses will be doing in the home if you are setting your frequency out for longer than 3 weeks. The management and evaluation, I'll go over in a little bit more detail here in a minute. The teaching and training, really and truly, teaching and training should be on every skilled nurse's visit. Anytime we're in a patient's home, even if we're doing other qualifiers such as wound care or ostomy care, as a nurse, we should always be teaching a patient and caregiver. That's just a part of our job, and making sure that that patient is safe in performing whatever skills need to be done in their home to take care of them and they're able to continue to live in their home. Administration of medications. This does not include administration of oral meds. These are your injections, your IV medications. So please make sure that anytime you are including administration of medications in your plan of care for your skilled nurses to perform, that it is some type of a skilled administration of medications. Tube feedings, your nasopharyngeal and tracheostomies, your catheters, wound care, ostomy care, heat treatments, medical gases, and rehabilitation nursing. All of these are qualifiers for nursing or even for a home health agency to be in a patient's home and receive reimbursement through Medicare. The heat treatments, medical gases, and rehabilitation are 3 particular tasks that we don't perform through Home Care Network. But at this time, I want to go over management and evaluation. Management and evaluation has to be performed by only an RN. So if a patient is put on management and evaluation, or you may sometimes hear it called M&E, only an RN can visit that patient. And that is basically saying that the patient is stable enough not to need observation and assessment, but they continue to need a nurse to oversee the unskilled care given by a caregiver to prevent exacerbations and rehospitalizations. And under the LVN's scope of practice, they are not able to manage. So the goals for M&E are to prevent exacerbations and rehospitalizations, to minimize complications, to monitor and evaluate underlying conditions. If a patient is placed on M&E, no other skilled disciplines can be in the home, so you cannot have a patient on M&E and then also the patient have therapy services in the home. You can go over to your nursing reference guide for more details on M&E and the other Medicare qualifiers. Case conference. If you have case conference at your particular office, not all offices have a scheduled case conference, but if your office has case conference, it is weekly. It is set at a certain time on a particular day for your particular office. If you work for two or more offices, just make sure that you are contacting the offices and giving report if you're not able to make it to all of the case conferences for that week. So any case conference that you miss, you must make sure that you are calling into the office and giving report. During case conference, a list of the patients that are coming up for recertification in the next couple of weeks is reviewed. This list is given out by the office manager a week prior. So even when you come to case conference, you will receive the list for that meeting, plus the list for the upcoming case conference in the following week to make sure that you are prepared when you come to know what patients to discuss. You are reimbursed for attending case conference. Each discipline is to give report on what has occurred in the past 60 days in order to complete the 60-day summary. As a Medicare qualified certified agency, we are required to give a 60-day summary or a 60-day report to the physician on what has occurred in the past 60 days with that patient. We also have to let the physician know if we're going to discharge the patient or if we will continue with services and recertify that patient, and the reason we will recertify. The RN is responsible for completing the 486, which is where we put our 60-day summary information when the recertification is done. So this allows the RN to be able to get in information from all disciplines on what has occurred with that patient in the past 60 days. Okay, let's go over the teaching. You want to make sure that any teaching that is chosen to be done during that particular survey period is relevant to the patient's needs and relevant to the care that they need to receive. Each nurse should use nursing judgment and knowledge to choose the relevant teaching. The following should be taught on every Oasis: your starter care, your resumption of care, and your research, your emergency care plan, your emergency preparedness, and your after hours on call. Those three things should always be on any type of Oasis visit that you perform. Make sure you are documenting that information in your narrative of your Oasis. For billing, there is a billing coordinator for each office that sends out a billing list, and that list is sent out daily. The office manager goes through that list, and also the director of nursing and all office staff throughout the day, and we are required to clear that billing list if at all possible by the end of the day. So anytime that you are seeing a note on your particular visit that says it's a first billable visit, please pay attention to that and note that if at all possible, we need that particular note to come in to the office as soon as you can complete that documentation. You will probably receive different emails or calls about receiving information in so we can go ahead and bill. The one thing I want to point out is I don't want any staff to get the misunderstanding that the agency is just focusing on billing and pulling in money. Our number one priority as a home health agency is our patients, and we want to make sure that we're also taking care of our employees. But you have to understand that in order for an agency or any business to run and run smoothly, the money has to come in. So the reimbursement is based on our billing and when we get the billing in. So we have to make sure that we're staying on top of billing, and our billing department make sure that the offices are staying on top of those throughout the day. So please just make sure that you are being cooperative whenever you are asked to get paperwork in so that we can make sure that we are able to bill, because keep in mind we need the money to come in from Medicare and other payer sources in order to meet salaries, pay for cars, benefits, and all the other things that the agency has to put money out for. On non-admissions, please make sure that anytime a patient is a non-admit, that you are going to the communication note under that patient's chart and documenting the information as to why that patient was a non-admit. The director of nursing is responsible for making sure that those communication notes are written. Also, if for any reason a patient was not admitted within 48 hours, we need that documentation, because we do have to notify a physician if a patient is a non-admit and or if a patient was not admitted within 48 hours. And then this information will be kept on that patient's chart, and it could be pulled up at any time. Time off requests. All time off is first come, first serve, and that is reviewed and approved by the Director of Nursing. You want to make sure that you are going to the HR website and filling out a time off request. On your skilled nurse in services, your Director of Nursing is responsible for conducting the skilled nurse in services, but they may also be instructed by a QA director, your administrator, or corporate educator. We are leaning more towards getting all of our in services in webinar form so that you are able to log on, hear the in services, and then your attendance is documented because it can be printed off from who attended the particular webinars. We are trying our best to keep the staff from having to come into the office on a regular basis. So any mandatory in-services that are sent to you and you've received that invitation to attend a webinar, please make sure that you are attending those webinars. And we are making sure that we are setting up more than one webinar on different days at different times in order to give you the opportunity to have several different options, because we do know you're out in the field and seeing patients. Okay, let's review on call. Every nurse that is employed at Home Care Network does have to take part in the on-call rotation. And the frequency of that on-call rotation depends on the number of nurses that are in your particular office. So if you have 5 RNs that work in your office or work for your particular office, you will have call every 5 weeks. So it just depends on the number of RNs that work at your particular office. On-call schedule should be given out by the Director of Nursing at least 2 months in advance, but keep in mind that she may have to make regular changes as staff also changes. Call begins Friday at 5 p.m. and ends the following Friday at 8 a.m. So you will receive calls as the on-call nurse during our after hours. There's an RN and an LVN on call together. The LVN is scheduled to perform all of the regular skilled nurse visits, so that will free up the RN to be able to perform all the Oasis visits that are needed. Make sure that you pay particular attention to your on-call instructions in your nursing quick reference notebook, because it goes over it in detail. Policy and procedure. That manual is kept in the director's office with availability to staff whenever needed. These are the policies and procedures adhered to by Home Care Network. Healthcare Consult Link is the company we use to keep our policies updated on a monthly basis. They mail those policies and changes to us. They're reviewed by the office, and then we instruct the staff on the new policies. Now, we are, once again, trying to cut down on the frequency of the field staff having to come into the office for particular meetings. So anytime that we receive new policies, we are now emailing these policies out. When you receive an email with new policies, please make sure that you are reviewing those policies and send back a reply to the email saying that you have acknowledged the receipt of those particular policies so that we can make sure that we are keeping that with our policy and procedure notebooks. Nursing procedures. There is a manual that is kept in the Director of Nurses office that goes over your nursing procedures. These are basically your skills. So it contains the processes for clinical procedures for the skilled nurse in the field to follow. So if at any time you may feel like you need to brush up on some of your skills, go to your Director of Nursing and ask for that nursing procedure policy book to be able to brush up on your skills. And also, if there's any particular skill that you are asked to perform that you do not feel comfortable with, please make sure that you are notifying your Director of Nursing so we can get someone out there with you to go over any instruction and do a check off, because we do want to make sure that all of our staff is comfortable with all the skills that you are asked to perform. Your nursing quick reference. When you are hired on, a part of your orientation, you would receive your nursing quick reference book. This goes over a lot of the different things that we've spoken about during this particular portion of the orientation in detail. So please make sure that you are holding on to your nursing quick reference. This is something you can keep in your bag or something you keep in your car somewhere that you can always reference back to. And anytime that you have any questions, you want to make sure again that you are contacting your Director of Nursing, or you can also contact your corporate educator. For the insurance, please make sure that you do go to your nursing quick reference for your insurance list to make sure that you do know which insurance payer sources we do 30-day cert periods on and which ones we do 60-day cert periods on. Some particular insurance companies require additional information, while others bill just as Medicare does. So please make sure that you are familiar with that. We will have assigned to you a skilled nurse evaluation on all insurance patients. It's usually scheduled 2 weeks out from the admission. At that time, we need you to go to the communication notes section of the patient's chart, click on your drop-down box, and make sure that you are choosing to document your insurance evaluation. That informs the office if we will be able to discharge that patient at the end of the certification period, or if that patient will need our insurance department to contact the insurance company for additional authorization. This is very important to get that completed, because we've had patients in the past who've had delay in their care because we waited until the last visit to notify the office that more authorization was needed. And sometimes these companies take up to a week in order to get back with us to authorize visits. So we want to make sure that we do not have a delay in that patient's care or their needs. So again, when you're taking care of insurance patients and you are assigned an evaluation visit, please make sure that you're completing that evaluation communication note in order to make sure to notify the office if additional authorization will be needed. Okay, on OSHA, Stericycle is the company that we use to be in compliance with OSHA guidelines. Stericycle has a scheduled pickup time for each office for disposal of biohazards, and you can double check with your office on those particular pickup dates. You want to make sure that any of your biohazard that you have taken from the patient's home, that you are bringing to the office so that can be disposed of properly. Um, There are some mandatory in-services through Stericycle, and also Stericycle representative comes to the office and conducts an annual mandatory in-service, and does an office inspection at that time to make sure that we are following OSHA guidelines on the office side. Please make sure that you do attend the annual mandatory in-service. On your wound protocol, just a couple of things we need to review. Make sure that you are measuring wounds weekly. Make sure that we are performing 14-day wound evals, and during that time pictures need to be taken, and also the 14-day wound eval communication note needs to be filled out so that can be sent to the physician, and at that time we report either the progression or the decline of the wound. On the finance department, just real quick, because we did go over this with your nursing quick reference, anytime you have any problems with your cell phone or other devices, make sure that you are notifying your office manager and they will get with the finance department. If you have any questions about your payroll, please make sure that you are contacting the office manager or human resources and they will get that taken care of. On the medical supply side, please make sure that you are aware that each office has a budget depending on the census of that particular office. Anytime you're needing medical supplies, make sure that you are emailing your needs to the medical supply email address. That way, everyone who is responsible for ordering medical supplies will receive that email and get you your supplies in a timely manner. Again, please make sure that you are emailing your supply needs to that email address so we ensure that your medical supply needs are being met and there's not a delay. If you have any emergency supply needs, please make sure that information is directed to the Director of Nursing, and then that request will be made to the Executive Administrator. On the dress code, just a quick review of it again. For the field staff, you want to make sure that you're wearing neatly pressed scrubs, closed-toe comfortable shoes. Make sure that you're always wearing your name badge in the patient's home. Keep your jewelry to a minimum, and all tattoos and body piercings should not be visible. On the Professional Advisory Committee, or you'll also hear it called the PAC, if you are asked to be a representative of the PAC, please make sure that you do complete the form saying that you do consent to being a part of the committee. The committee is represented by each discipline that we have with our home health agency and also a community liaison. The committee meets once a year with the medical director. We go over any new and changed policies. We go over the agency's report card and the annual agency evaluation. On the peer review committee, if you are asked to be a part of the peer review committee, please make sure that you do understand it is confidential. Any information shared during a hearing is confidential. If you're an LVN and an LVN comes up for review, you will be asked to come in to be a part of the hearing, and same for the RN. If an RN is set up or is reported for review, then only RNs can be a part of the hearing. Director of Nursing cannot be a part of the committee because they cannot participate in review of their own staff. Make sure that you do have an understanding of the peer review committee before you sign on, or even once you sign on, please make sure to review the notebook for all details. On the STEER in your admission packs, you want to make sure that the STEER information is filled out for all your EPC1 patients. That is signing those patients up for emergency preparedness in case there is an evacuation, that we've signed those patients up with the government or with the state in order to be able to have evacuation services. Just make sure on our office procedures that you are following all procedures and policies that we do have in place. HCN has been in business for many, many years, and we have put procedures and processes in place in order to make sure that the company does run smoothly, and we do ask that everyone adhere to those policies and procedures. On your visit orientation, once you are completed on the office side, you will be assigned to ride along with one of our experienced RNs. Once you are comfortable and feel that you are ready to be independent in going out into the patient's home and receiving your own schedule, you will be scheduled with another RN for checkoff. Once you are checked off, you will make sure that you will get with your director of nursing and your office manager and scheduler at your office to start setting up your schedule. Okay, that is the completion of your FieldRN Orientation. Please make sure that if you ever have any questions that you do direct your questions to your director of nursing. And if you have questions dealing with any of your training, make sure that you do contact your corporate educator at lwilliams@homecarenetwork.com. Again, your corporate educator is Latanya Williams. You can contact her anytime at lwilliams@homecarenetwork.com. Welcome aboard and thank you for your time.